To lead our discussion today, I'd like to introduce you to the session moderator, Dr. Jennifer Young. Dr. Young is a third-year postdoctoral fellow at the Stanford Center for Biomedical Ethics. Dr. Young is a trained couples and family therapist working across the fields of public health, mental health, family systems, and genetics. She completed her PhD in family science at the University of Maryland in June 2018. Prior to receiving her doctorate, she received a BA from the University of Wisconsin-Madison, an MA from The Ohio State University, and an MS in Couples and Family Therapy from the University of Maryland. She recently completed a 4-year fellowship at the NIH in the National Cancer Institute's Clinical Genetics Branch, where she worked as a psychosocial qualitative research specialist and mental health clinician. Her research at Stanford University currently focuses on advocacy for culturally tailored mental health resources for families with rare genetic health conditions. And now I'll turn it over to Dr. Young. Thank you so much for joining us.
Hello, everyone, and welcome to our session, Rare in the Family, Navigating the Roles of Patient, Parent, and Caregiver. The learning objectives for this session today are to recognize that many families live with a rare disease diagnosis and that affects multiple members of the family. Secondly, we want to determine ways to wear many hats and strategies to address the needs of each family member to improve family dynamics. And lastly, we're going to discuss how to cope with some feelings of guilt, selfishness, and worry about future of the family. And I'm so excited to be joined by Tammy Jones and Adam Johnson for this session. So you already heard a bit about my background. A lot of my research has been done using in-depth qualitative interviews with folks who have a rare or undiagnosed disease. So I spent a lot of time over the past 7 years listening to people's stories and also advocating for more mental health support for folks with rare diseases. Since this is a panel about rare disease in the family, I wanted to share some of my own findings about how these diseases can impact a family. So families are very delicate ecosystems, and a slight change in one part of that ecosystem can be felt by everyone in it. And that includes children, who are often smarter and more perceptive than we know. That's why it's really important to include all family members in the experience of living with a rare disease and to talk to families as a whole, especially because of the important and varied roles that each one of us play in the lives of those that we love. Now, I do want to acknowledge that families take different shapes and forms, and some of them are biological and some of them are formed over our lives. And I also know that some family relationships bring us more pain than comfort. So it's important that you are in touch with your own needs and clearly communicate those needs to family members so they know how to best help you. And one example I just want to tell you about for my own research is been focused on couples, mainly in which one partner has a rare disease and the other doesn't. And I've seen helpful patterns of communication in couples, such as kind of alternating who's shouldering the emotional burden, who's taking care of the kids, who's taking charge of what roles in medical decision making. But I've also seen not so helpful patterns such as protective buffering, which is the phenomenon that happens where one partner hides some negative information from the other in an effort to protect them or shield them. But alongside that, the partner who doesn't know about that information and finds out later feels not so great about being hidden information from. Also, because of the ambiguous and chronic nature of so many rare diseases, the ongoing stress is really hard for people's minds and bodies to handle. And that's why it's so important to talk about how we can take care of ourselves, how we can juggle multiple roles as best we can, and how we can build resilience and positive coping styles, including asking for help. So with that, I want to introduce our first wonderful panelist, Tammy.
Hello, everyone. My name is Tammy Jones. I am from Arkansas. I am the Arkansas Rare Action Network Volunteer Ambassador. I'm going into my 3rd year working as the state ambassador, and in that time, I have learned so much about so many different things, and you're going to hear some of those things as we move forward. Let me tell you a little bit about this slide that's up here. You've got my whole family in front of the Christmas trees, and as you can see how many there are 5 of us that have a bleeding disorder. Then, of course, my family of support. And at the very end, probably my most important and wonderful picture is my grandson and my granddaughter. My granddaughter struggles with type 1 diabetes, and my grandson also has our bleeding disorder. This is our first step of advocacy, and you will hear more about advocacy as we move forward.
All right. And our next panelist is Adam.
Thanks, Jenny. Hi, everybody. I'm Adam Johnson, and I'm an educator turned dadvocate. So I would say I really latched onto that term dadvocate because I like to make sure that I get the dad in there first. As you can tell from a lot of these pictures, that's something that really means a lot to me and my 2 sweet kiddos. And so I've got the dad first and then the advocate second, and I'm advocating for rare disease now. 2 years ago, that wouldn't have been even anywhere close to being on my radar. I did have some symptoms that started to pop up, and it took a while to get to the point where I could figure out what was going on. I call it the diagnostic odyssey. And I finally got my diagnosis in October of 2019. Found out that I had mitochondrial myopathy, 2 words that I've never really used before, especially together. And a few months after that, discovered a secondary yet related disease that takes a toll on my respiratory breathing system. So about a year ago from now, I was still grappling with what do I do? How do I navigate? Where do I go? And that's when I jumped into the advocacy role, hoping to own my story a little bit more and support others through their journeys while also being supported myself, because I realized that I definitely needed that help and that support, just as we all do. And working through some of the challenges around rare in the family and this topic that we're discussing today has been a big thing for me, particularly on the parental side. So now here I am, and it's a pleasure to be here. And I want to thank Nord for having me, and Jenny and Tammy. I'm excited to learn and talk with you as we get started here.
Wonderful. Well, thank you both for those introductions. And I'm just going to start us right off with a question that really gets at the heart of what I think this panel is about. And that is, what are the different hats that you 2 wear, whether that's as a patient, as a parent, as a caregiver, and beyond? And how do you navigate those roles? And Adam, why don't you kick us off?
Yeah, that sounds good. There certainly are a lot of hats that we wear, right, with the different roles that come up. When I think of hats, I harken back to my younger days when my grandfather used to wear hats. He had all sorts of hats all the time, but one of his favorites that I noticed was one that had 2 bills on it, one facing kind of diagonally left, one facing diagonally right, and on the hat it said, "I'm their leader, which way did they go?" And that just cracks me up all the time. And I'm not sure how much of a leader I am, but I do know that the "which way did they go" communicates to me. So of course there are many different hats that we have. I've got the the husband, the brother, the son. Some of the ones that we don't really think about necessarily a whole lot, we become, like an expert in our insurance and our policies. We become scheduling connoisseurs, right? Trying to figure out how to manage all of these things and put them together with the various doctors and appointments. I'm a very persistent follow-up extraordinaire now. Like you got to continually be on the ball, reaching out, checking in. And then I'm a conversationalist as well. You've got to be able to strike up some combos and be able to get in there with people and build relationships. But if I was going to narrow things down a little bit further, again, I would say that, I'm the dad first and then the advocate second. And the advocacy hats are, both in terms of rare disease at large, for others in the community that I've met and come in contact with, and then for myself as a patient. And it's a difficult balance. Oftentimes the patient side or the self side might go to the end, but I do need to remember myself, as you mentioned at the beginning, Jenny. And that's, it's easier said than done, because sometimes when I do put some of my needs up front, I do get those feelings of guilt, but I need to remember to be kind to myself and try to navigate all these different things and put them together. It's kind of like the old Tetris game, right? Where you've got all these shapes and they're, you tweak and adjust and rotate and try to figure out where's the best spot for them. How do we put this together? And then they keep coming and falling faster and faster. So I try to balance and stack these hats in the best way that I can.
That's great. Thank you so much, Adam, for sharing. And thanks for pointing out those kind of more traditional hats that we think about, as well as the invisible ones that take up so much of our lives.
Yes.
I really appreciate that. All right, Tammy, what about you? What are the hats that you wear, and how do you navigate wearing multiple hats?
Well, the hats that I wear, first, I'm a patient, I'm a parent, I'm a grandparent, I'm a daughter, I'm a wife, I'm a caregiver, I'm an advocate, and I'm a mentor. So I wear a lot of hats, and pretty much I use my mentorship and advocacy roles to navigate all these different roles and hats that I wear, because mentoring sometimes is needed through personal challenges. And then, of course, you come to the advocacy part, and that is needed in the physical and the medical challenges that rare patients face. Sometimes it's speaking up, and sometimes it's speaking out. But then sometimes it's just a matter of holding to that accountability, because I believe that so many times we have a fear when it comes to the care for our disorders, and we're afraid to say something because, well, the doctor knows more. That's just not necessarily true. So holding accountable yourself as well as your care team is very vital and important to a rare disorder patient.
Absolutely. And I also love, Tammy, how you touched upon how a caregiver can take multiple forms. You're a caregiver to the people that you mentor, as well as, your family members that you care for. So I appreciate that. A follow-up question. I'm curious what you all think has been the most difficult aspect of all of these different roles, maybe the most challenging hat. How do you deal with that most challenging role in your life? Let's start off with Tammy this time.
Well, I think the most challenging hat is being diagnosed efficiently. There's so many misdiagnoses to so many different rare disorders. So that is a vital part, is being diagnosed efficiently, being heard. We need our voices heard. We need people to listen, because we live this every day in our personal lives with just ourselves. And as you heard from my caretaking, several, and there are different things. You'll actually hear me share a little more of that in one of our questions. But I think it's also finding that cohesive care. I advocate to bring awareness to anyone who will listen. So bringing awareness is also a vital part of advocacy, and it's just kind of a different step that we do, because we want to make people aware that this is out there, but then we want to advocate for the best care that they can get. My story is my most powerful um, advocacy awareness role, so I share it because it's just important.
Yeah. I mean, the beginning and end of what you said, Tammy, I think touches upon being heard, right? Being heard by people in the medical system, being heard by policymakers. I think that is something that I've heard over and over is a really big challenge, and also so vitally important. So thank you. Adam, what about you? What's your most challenging hat, and how do you deal with that aspect?
Yeah, I think one of my most challenging hats might actually be some of the ones that I think I lost, or that I actually did lose because of the circumstances that came up. I went through 35 years of life, and while I can look back and think, oh, maybe this was something that popped up, maybe this was a red flag, maybe I could have seen it coming, 35 years worth, I was able to kind of navigate through until I couldn't anymore. So I think some of those hats that I've lost might be the most difficult for me, and that the reason for that would be the loss. I mean, it's just been an incredible amount of loss over the last couple of years, from my health to my job to some freedoms that I used to take for granted. some of my friends, my mobility, my stamina, any little hint of athleticism that I might have had before. Not that I could like dunk or anything when I was playing basketball, right? But but I used to get after it, and a lot of those different things have been taken away from me, and it's a lot to lose. And when I think about those things, it's not only it's what I used to have, right? And then it's what I had at the time, and then it's what I thought that I would have moving forward. And the same could be said for my family and the family members that I have. In terms of dealing with it, that's tricky. It's tough, and I'm still a work in progress there. I try to start by giving myself permission to feel. I've really grasped onto that wording and that phrasing from Dr. Mark Brackett's work in his book, Permission to Feel, because this journey is a lot to take on. It's a lot, as all the folks in the rare disease community know. So recognizing that and understanding that and then giving myself permission to feel has been big. And it sounds odd, but I didn't realize that I was grieving, because I always used to associate grief with death. And once I figured out, hey, I am grieving, I need to allow myself to do that and recognize that's not a linear process, right? There's going to be ebbs and flows, and it's never done. As much as we'd love to check it off the list, right? That's not how it goes. And so again, I need to allow that process and allow myself to do that. And it becomes difficult because oftentimes there's these secondary losses that can be just as difficult as some of the primary ones. And I learned a little bit about that through Megan Devine's work. In her book, It's Okay That You're Not Okay, she talks about how normal life tasks can bring your loss into the sharpest contrast. And that happens for me quite often. I find, I'll find an old picture that shows my previous activity or the way that I used to look, and I'll see a post from a former colleague on a platform, or I'll discover a memento from a past trip or something like that. So for me, those are some of the difficult hats, those things that I've lost, and it comes back to that permission to feel, recognizing it, mm-hmm. acknowledging it, but not necessarily living there all the time.
Mm-hmm. That's really profound. I think the grief that you shared, feeling about the past, the present, the future, I think it's really important to face it and to feel it. I think a lot of times some of our other hats make it so that we don't have the time to make space for those feelings. And so I really respect that you're doing that work, and it's an ongoing process. So
I'm trying. Yeah.
We're all a work in progress.
Mm-hmm. Yeah.
Okay. The next question, we're going to jump into families. So as we all know, rare disease diagnoses affects the whole family system. So can you talk to us about how you communicate with your family about your rare disease, and maybe just give us an example of how you do that? And let's start off with Adam.
Yeah, so you mentioned early on, Jenny, how perceptive the kids can be, and whether we know it or not, they are incredibly perceptive. And you hit the nail on the head, especially when it comes to my two kiddos. I'll kind of go that route here and say that discussing my process with my kids has been incredibly difficult, super challenging. There's lots of worries that come up as you're starting to go through the symptoms and the diagnosis process. What's going to happen to me? Are my children at risk? What emotions will this evoke for them? And what's next? So, they obviously knew something wasn't right, as you mentioned, that perceptive nature that they have. I started cutting back on work trips. I really wasn't feeling well a whole lot. I had to rest a bunch, had a lot of different appointments. And so, it was difficult, but after I got that diagnosis, I tried to put it into kid-friendly language the best that I could. I'm a teacher. I used to be an elementary school teacher, so that that's what I did, and I'm kind of used to that. But I'll tell you, this was the most difficult lesson to try to put into kid-friendly terms. So I did my best with it, and then tried to let them digest, and they did that at kind of their own paces. My son's 4, and he thinks things like the ventilator that I have to help with my breathing is cool because it's got tubes and buttons, right? What 4-year-old boy doesn't want to push the buttons? So he helps me out with that stuff, and he'll grab things for me, and he's starting to recognize as well and get a little better at it when we're playing or something. I'll be sitting on the couch or in a chair on the floor or something. The other day, he must have been able to see it. I just wasn't feeling well, and he came up and he put his hand on my arm. He's like, "Daddy, do you need a little rest time?" And you're like, "Oh man, you know what, buddy? I do." Like, but let's finish our game out, and then we'll do that. So it's really, really sweet. My 11-year-old daughter has the biggest heart, and she's just the most kind person, and she doesn't want any pain or discomfort or anything for anybody. And so for her to kind of see her dad go through that, that's tough. So that initial conversation with her, again, kept it kind of basic and high level, let her digest. And I knew she was ready to move the conversation forward when she came home from school one day, pre-pandemic. She's in 4th grade. They're doing a project on the body. And she said, "Hey, Dad, we're doing this project. We have to teach the class about a part of the body. And mitochondria wasn't on the list, but I asked my teacher if I could do that." And I'm like, oh, man, it just hit me. I mean, it's one of those like paradoxes, right, where you're like incredibly proud and also simultaneously heartbroken because I wish she wasn't in that position to kind of have to do that. But that was also her telling me she was ready. And, I finally kind of recognized that. So what did we do? We dug into it a little bit. We found some resources. She studied, she shared and taught her class about mitochondria. And then we use that as a reflection point because as I'm finding out, advocacy can be really emotional. It can be taxing. And that's something I wasn't prepared for when I kind of moved into this space a little bit. But, I recognize that it's tough for me. That had to be really emotionally difficult for her. It's positive, but it's tough. And, so it's okay for me to kind of let my kids see that it hurts for me, that it's hard, that we're feeling those things, which can then lead to more conversations because it's a lot to carry. So I just try to be as supportive as I can.
Definitely. I love that you have left the door open to them when they have questions, when they are ready to talk, they know that they have someone to go to. I think some of the hardest things for children that I worked with is when they are scared and they don't know who to talk to. So it sounds like you have a big heart. Your children have such big hearts, and you can connect in that way. It's really beautiful. Thank you.
Yeah, thank you.
Tammy, what about your family? How do you all talk about your rare disease? And do you have an example to share with us?
I do. Yes, it takes a big toll on our families. I am one of 5 rare bleeding disorders in my family. I am the caretaker for a type 1 diabetic, my granddaughter, for 2 type 2 diabetics, for hypoventilation syndrome with one of my family members, and I'm also the power of attorney for my mother who is struggling with dementia. So it comes into those hats. This is an everyday thing for me. How I communicate a lot to my family about the rare diseases is I emphasize the importance of good care, first of all, and how important it is to show respect to your physicians, however many there may be. Yet, I use the word yet as opposed to but because to me it gives a little more of a positive connotation. Yet, we live with this disease every day. We see our doctors maybe 3 months, 6 months, 12 months. It just kind of depends. They see us for that few minutes. So we have to be bold enough. We have to make certain that we are freely talking with our doctors, asking, letting them know about our concerns. And I know that sometimes when we get to a doctor's appointment, it's really tough to remember. So I've learned to make notes in my phone. And of course, there are several patients. So sometimes I definitely need to do that. They have learned a lot about being comfortable with their doctors and just being open and honest. And so for that, I'm very grateful. You have to trust your body, and just let that do away with the fear. You ask of a couple examples, and I am going to share two quick ones here. The first one is on the first slide, you saw my two grandchildren. My grandson has a passion for football. He wanted to play football so bad. He is one of our bleeding disorder patients. That just did not seem in his best interest at all. So I reached out on the internet several years ago to the coach, the football coach at our school here in Greenwood, and just said, this is who I am. This is my grandson. I sent some pictures because he's actually been at ball games since he was a toddler, high-fiving the players as they come out. And there's an attachment that happens there. And so I said, he cannot play football because of this reason. Is there anything that he could do on the football team? Now, let me just say that was a far reach for me to send out an email to a coach, thinking I'll never hear anything back. I didn't say anything to Riley because I didn't want that disappointment. Sure enough, in about 4 days, he sent me an email back and said, absolutely, thanks for sharing your story. And when he gets to 7th grade, he was in 6th at that time. When he gets to 7th grade, you have him call me. If it's just watching films, we will make sure that he gets to do that. So as that moves forward, his passion was to be a physical therapist. So what better way than to be a school trainer? And he is in his 4th year. He is doing absolutely amazingly well, and it just continues to strengthen. So that advocacy step that he took, okay, I can't be on the field in that uniform, but I can be on the field in another uniform, and because they do have to wear their shirts and certain dress, but it's also teaching responsibility and commitment. The second one I will share real quickly is about my granddaughter, and I have to talk about my grandchildren because I'm a firm believer advocacy starts as young as the kids can understand and they want to be a part. They don't want to feel left out. So we did a ladies' night out, and here in our little town, and so she had her pump on. This older lady came through with her daughter. She had just been diagnosed about 2 weeks before that. And of course, she's in her late 60s, and which is highly unusual. She was like, her daughter says, I tried to get her to pump. She won't use it. She says, no, it's going to be too complicated. And my granddaughter was young at that time. And her words were, sorry, here's my pump. This is what it does for me. And this senior lady said, you know what, sweetheart, if you can do that, so can I. What better stage of advocacy? We need to give them that openness. We need to let them know about what they're dealing with every day. Adam, I love the way that your children are so involved, and so I just want to encourage everyone. It is so important to let your families be a part, help them understand, and leave that door wide open for questions. Mm-hmm. So that's pretty much how we kind of make it through, just a lot of open communication and knowing that it's okay, like you said, Adam, not to be okay.
Mm-hmm. Mm-hmm. Yeah, I mean, I think you both shared some really beautiful examples of both how you model advocacy for your children, but also the creative ways that your children and grandchildren have found pathways to advocacy themselves. It's really amazing to see. And this next question kind of goes along with that. What are some active coping strategies that you two use to deal with some of the harder feelings that come up, whether that's of guilt or concerns about the future? What are some of the active things that you do to deal with that? And Tammy, let's start off with you.
Well, 21 years ago, we were diagnosed with a rare bleeding disorder. I have VWD. I also found out at that point in time I was a carrier, but I also had it. Well, we've traced that back to my great-grandmother. So VWD is hereditary. Mm-hmm. At that time, I was overwhelmed. I went into a depressive state because what do I do? How do I do this? I have just passed along, even though I couldn't help it. I'm passing along this disorder to my children, my grandchildren, my great-grandchildren, and it just continues to go. So it was one of those things where I had to do something. And I remember as a kid, with a bleeding disorder, of course, you have nosebleeds, you have easy bruising. Sometimes you can touch a bleeder's arm and it'll leave your whole handprint, which brings on a whole other conversation sometimes. So, what I did with that is I decided that I was going to get more knowledge about advocating. The opportunity opened up for me to go to a class and learn about how to advocate in my community, and I jumped at it. So, sorry, there were so many unanswered questions growing up. So many horrific looking bruises. And I would say to myself, you think if I had a bruise that looks that nasty, I would remember bumping myself. I didn't. I did not, and of course, I was always told that's normal. Up into my early adulthood, I was diagnosed when I was in my 30s with my 11-year-old daughter. So um, I think that learning to advocate and just saying, you know what, I'm going to make sure nobody suffers like I did with all the unanswered questions, and finding a doctor that would know how to take care of us, because 21 years ago, there was one place in our state. I'm thankful that we have expanded, and we have definitely advocated on all levels, and we are getting more doctors and nurses, ERs, especially gynecologists that are learning about VWD, which is amazing for us because that lets us know that it's been a hard time. We've had some big challenges, but you know what? They're listening to our voices, and that is huge. So I just used the advocacy and the awareness to pull me out of that, and I began advocating, and that's what got me to where I am right here today, to be able to share and know the importance of being able to open up and let others know about a rare that we have in our family.
Thank you so much for sharing your story, Tammy. I really appreciate knowing that where your drive comes from, and where your motivation, is inspiring, I think. So thank you. Adam, what about you? What are some of the active coping strategies that you use?
Yeah, I would really echo the advocacy prompt and thank Tammy and other advocates who have kind of blazed the trail, leading up to this point, because I'm new to the space, relatively speaking. My coping strategies were really lacking early on. I didn't know what to do. I didn't know where to turn, kind of like Tammy was saying initially. And advocacy and connection have been my kind of way out. I'm a relationships type of a guy, and kind of going through the process of working through a rare disease diagnosis and then, afterwards figuring out what that means has been incredibly difficult. And then you mix in a little side of pandemic with that, and it's not a great combo, right? So in order for me to kind of get those connections and those relationships going, I had to go out on a limb, much like Tammy did going to that class early on. For me, it was starting in on social media. And so, if you've been a Twitter user for a while and in like late July 2020, your Twitter glitched out or something, it's my fault. I'll take the blame. Now you know why. I signed on, and it was the Twitter sphere trying to like balance out, right? Right. But I'm so glad that I did that. I've made some incredible, wonderful connections. I've been able to listen to and be a guest on a couple of podcasts and be involved in some chats. And I found, wonderful organizations like NORD. I've started a little bit of a blog and a website to kind of get some of my thoughts and opinions and emotions out, just to kind of help me, but also in turn, hopefully help others. And then I've been able to seek some disease-specific support, pre-social media for me, which I somehow avoided for 35 years before all this. I used the old Google machine, and I found MitoAction, which has been just such an important support for me. We've got weekly support calls. I've worked with them to do like a men's support group once a month. That's been fabulous. So those are some of the things that I use. And then to kind of bring it back for my daughter as well, one of her coping strategies has been to become the founder of Another Helping in partnership with Mito Action, which is basically my daughter's way to help those in the mitochondrial disease community. She spent about 6 months planning and preparing. She's kind of developed a website and her baking skills and a flyer to combine her love for baking with her love for helping people and supporting a few different causes with Mito Action, so folks can donate to one of the causes and she bakes. And so that's kind of her advocacy avenue, like kind of Tammy was talking about earlier. My daughter sees what I go through. She sees the things that I need to kind of get through, and she wants to help others. So, back to one of your points from earlier, Jenny, I think it's important to recognize that none of these things are necessarily like the right way to do it, but it's right for me, it's right for my daughter, and there are many ways to advocate, to connect, to support, to be supported. So for everybody in the community, it's really important to do what's best for you, and sometimes that might mean going out on a limb.
Absolutely. Thank you both so much, both for telling us about the work that you're doing and for doing the work that you're doing. I just appreciate hearing the many ways that you can advocate. Yeah. And we have about 10 minutes left and 2 more questions to get through. You both touched upon how important this rare disease community is, and obviously NORD is a huge part of that. And that really, that kind of social support is enormous. But I am curious, what are some non-rare disease related things that you do outside of this world, right, to cope and to take care of yourself and your family? And let's go back to Adam.
Yeah, that's a difficult one for me, Jenny, because as you're mentioning, rare disease, it's just there. It's all the time. We can't escape that reality, but it definitely is important to try to find some of those things. It's been an interesting mix for me. You can see the paintings behind me here. Those are a couple of things that are kind of affiliated with rare disease. It was a Mito Action paint night that we did. My kids were involved. We've got my son and my daughter's paintings behind me here, and they loved it. It was kind of a little bit out of the norm. It was something to look forward to. And there's been a few different events like that aren't all about the disease, but it's to benefit, the nonprofits. And so that's been a great, connection, a great way to move forward. And then in our family, sports is a really big thing. I'm a sports fanatic. I love it. So conversations with friends or family members, whether in the rare disease community or elsewhere, I would get along well with your grandson, Tammy. I'm a football fan as well. So I found this organization, the rare disease community, called Uplifting Athletes, through some of my friends that I've developed relationships with, and that's been fabulous. And I'm a big Cubs fan. That's been something that's been with me since I was a kid, watching with my grandfather. And the thing about that, the Cubs were there every day for him, as terrible as they were. They were there every day in his den, and he could count on that, and I can count on that too, with my kids as well, and they're becoming big fans. And then we try to mix it up and play, even though it looks different now. When I'm with my kids, we might get our sports fix in through, doing Wii Sports or watching on the TV or playing on the floor. And not to brag too much, but I'm a decent stationary goalie when it comes down to it as well. So that's kind of what I try to do.
Wonderful. Well, it sounds like you have actually found lots of ways to cope. That's great. Tammy, what about you? What are some non-rare disease related things that you do?
Well, our family works together and operates a fireworks building every year. We're going into our 16th year. It's hard work. It's a lot of fun. We're all together, doing it together, and we love it. We love just being out there. For people that come through. We've met some amazing people. We've had several different states that come through and oh my goodness, we'll be back next year. Yes, come on from Colorado to Arkansas. So we do that, and it is a lot of fun. The other thing that we do is in June, we have a lot of celebratory things, birthdays, anniversary, Father's Day. So about 5 years ago, we decided as a family, rather than spend money on a birthday and Father's Day and buy gifts for all of that, which, we do, we decided to keep that money and put it into a pot. And we do a weekend away in Branson, Missouri once a year. And that has been, it's just been amazing. It has been great for us. we live about 3 hours away, and we've lived here for 31 years. And up until about 7 years ago, had never gone to Branson. There are so many things to do. Um, we kind of got bumped from June to September with COVID. So hopefully we're going to be able to go back in June, but it's okay because we are celebrating together and we're making memories. And memories are the most important thing that we can do because it's something we have to hold on to. And just like the memories you were sharing, with your grandpa. And I'm just going to say, Adam, if you're not a KC fan, you could be in trouble with Riley because the kid is a KC fan.
Uh-oh. Well, I would say go 49ers, but the Chiefs took care of us in that one.
Oh.
Wonderful. Oh, Tammy, I'm totally stealing that idea. We don't need any more gifts in my family. The experience is really what we should focus on. That's great. Okay, so we're just going to wrap up with one last topic, and I'm going to start this one off actually talking about some mental health resources because as we've talked about, this is a hard thing that these families are dealing with. And as a therapist myself, I truly believe that everybody should have their own therapist, not just folks with rare disease, but everybody. I think it's really important, while we have strong family supports, it's important to talk to someone who's outside of the situation, who you feel like you can just completely unburden with, because sometimes I think we hold back trying to protect our family members. Right. And family therapy or just therapy can really help you work on communication skills. So, for example, telling people what your needs are, like I just need you to listen right now. I don't need you to problem solve. Practicing how you can kind of advocate for yourself in those family dynamics. Naming the disease, taking the power away from it. I think one of you has a really great quote about that. I'd love for you to share it later. And then, talking to someone in therapy can help you share your illness narrative. And sometimes we have kind of negative narratives around our illness, but really trying to retell your story in an empowering way, kind of in the way that Adam and Tammy have done today. And lastly, I think, having some professional support to deal with trauma and grief from, living with this. So I want to mention just some concrete resources, psychologytoday.com. That is my go-to for finding therapists. You can search by language, by specialty, by area, by insurance provider. They're wonderful, psychologytoday.com. I also really want to advocate for marriage and family therapists and specifically medical family therapists. This is a field that specializes in working with families like Tammy's and Adam's and can really help families cope with a range of things across the life course related to illness. And again, if your therapist isn't going to fit, keep trying. One of the biggest predictors of success in therapy is the therapeutic relationship. So if you all have any questions about that, we're going to put our email addresses up on the screen later. You can feel free to contact me. I'm happy to help. And with just the 2 minutes remaining, I would love Adam and Tammy to share any thoughts that you have about the topic of mental health or any other remaining thoughts that you have.
Well, I would say thanks for sharing those resources, Jenny, because it's really paramount. It's important. Rare disease is tough. It takes a toll, and the diagnosis is really a difficult path. Mental health has been a huge impact on me greatly through the journey and partly through some folks just telling me, hey, it's all in your head, kind of get over it. That's a tough pill to swallow. One of my doctors did give me some resources after recognizing that, it was probably vice versa, right? Where I'm having all this stuff and it's affecting my mental health. I didn't do it right away, but I finally did seek some help. And, Brené Brown talks about what we don't need in the midst of struggle is shame for being human. And when you have those mental health struggles, it's really just the acknowledgement you're human. And especially for me as a male, sometimes we look down upon or shove things aside, and seeking help isn't weakness, it's strength. And I think on the mental health side too, one of the things that's helped me, Michael J. Fox has his new book, No Time Like the Future. And I would definitely recommend checking it out. It's been a great read for me, but in the context that he's speaking at, he's relating to another person in the Parkinson's community, and he's trying to learn from that example. And he said, the mistake that I make, Michael J. Fox said this about himself, the mistake that I make at times is to assume that my kids are looking at what I can't do and not what I can do. They see through the disease and they see their dad. And that's an important thing for me to try to remember. And I'm more than happy to support others through that journey as well, if it's helpful.
Thank you.
And mental health, as I was thinking about this question, it's a rare, right? I mean, finding the correct diagnosis, finding the correct combination of medications, the correct doctor to help with that healing. So that's how I think of that. And so maybe that will help someone. Recently, some advice was given to a young girl who has a chronic illness, and she was saying that the illness, you are not your illness. You are you with your illness. So I think we need to remember that we are who we are, and we need to define our illness and our disorder and not let it define us, because that's a good step of advocacy right there, just to you define it and know that you are still a person.